So we have NBE demo test which is available in NBE website. So most of you who have taken the test are really worried about the type and pattern of questions, but let me reassure you that these questions are framed keeping the medical profession in mind in general. Okay, it's not dental specific. Anyways, we'll try to have some discussion pertaining to those questions. I'll give you the key and explanations and consider this as a bonus. Okay, even if you have no idea, that's absolutely fine, because as I said, these are designed keeping the medical profession in general in mind. It's not just confined or specific to dental profession. Okay, shall we start? So what I'll do is post questions, key and explanations, and you can review them real quick. Okay, starting with the first question. All of the following are true regarding lateral medullary syndrome except. So option B, it's exclusively caused by occlusion of posterior inferior cerebellar artery. It's an exception because this lateral medullary syndrome is also because of other arteries involvement, that is blockage most commonly in vertebral artery or posterior inferior cerebellar artery, or even superior middle and inferior medullary arteries, as you can see in the explanation. Okay, now let's move on to the next question. Which of the following drugs will unmask Tourette syndrome? So we have a few case reports and also some literature review. Option C, methylphenidate, is the right answer. And third question, an increase in hirsutism seen after menopause is related to which of the following changes? So it is option A, because of increase in ovarian testosterone production as evident in the explanation. Fourth, which of the following pituitary hormones are the last to be affected following cranial irradiation? It is TSH, option B. And also you can find some relevant explanation pertaining to this. Globoid cells, fifth question. Globoid cells in Krabbe disease are degenerated. Ganglion cells, astrocytes, peripheral nerve endings, oligodendrocytes. Option D seems to be more appropriate. However, in some of the literature, it's clearly mentioned that these globoid cells are actually derived from either microglia or infiltrating peripheral macrophages. So just keep this additional information in mind. Sixth question, which of the following is the absolute indication of urate lowering therapy in gout? So you can find some literature where option A, tofi, is the right answer among the given options. Okay, so just make sure that you are familiar with these indications related to treatment of gout. And seventh question, periductal onion skin fibrosis and inflammation are characteristic of its option C, primary sclerosing cholangitis, and also you can see the histopathologic image. Eighth question, which of the following would be the most sensitive test for an acutely ill AIDS patient with suspected cryptococcal meningitis? Cryptococcal antigen in CSF along with sensitivity percentage is mentioned in the explanation. You can go through it. Option D is right answer. Ninth question, phosphatoin which is regulating phosphate metabolism is option A, FGF23 is right answer. So fibroblast growth factor 23, it's a protein that in humans is encoded by FGF23 gene, which is a member of fibroblast growth factor family, which is responsible for phosphate and vitamin D metabolism. And 10th question, gynecomastia is associated with which of the following tumors? You can find the list or the table here. Option B, adrenal tumor, is the right answer. 11th question, medium chain triglycerides used as nutritional supplement are present in large amounts in which of the following? Coconut oil is the right answer, as evident in the explanation. 12th question, which of the following has been consistently shown to improve outcomes in patients with primary sclerosing cholangitis? Option B, UDCA, is more appropriate among the given options based on the explanation. 13th question, Janssen disease is associated with which of the following? Option C is more appropriate answer, right? You can find the relevant explanation as to why we need to exclude the rest of the options. And 14th question, patients with autoimmune pancreatitis commonly present with, it is painless obstructive jaundice. Option C is more appropriate answer. 15th question, which of the following is true about tyrosine kinase? It's option C. Tyrosine kinase or protein tyrosine kinase adds a phosphate group to select protein targets. 16th question, the most accurate preoperative local staging of pancreatic malignancy is done by which of the following? CT and MRI seem to be the right answers, but comparatively MRI is even more accurate based on the explanation which is given here, right? Because the question is the most accurate, so MRI would be the more appropriate answer. And 17th question, osteoporosis is caused by which of the following? It's adrenal insufficiency as evident in the explanation. 18th question, all of the following are characteristics of mesial temporal lobe epilepsy except option B is the exception based on the explanation which is given here. And 19th question, the penultimate, which of the following is an anti-inflammatory cytokine? So both option B and D, that is IL-6 and IL-10, are right answers based on the given explanation. Final question, Gerstmann syndrome is characterized by all of the following except option A is right answer, that is alexia. Gerstmann syndrome, as you can see, it's a syndrome which is characterized by loss of 4 specific neurological functions, that is dysgraphia or agraphia, which is inability to write, acalculia, that is loss of ability to do mathematics, and also the inability to identify one's own or another's fingers, that is finger agnosia, and also inability to make the distinction. So these are some of the features of Gerstmann syndrome. So these are some of the questions which were asked in your NBE demo test 2020. It's absolutely fine even if you have no idea, and as I said, these are designed keeping the medical profession in mind, not dental specific. Okay, so if you have any queries or you need any further assistance, you can always get back through mail at proudtobedentist@gmail.com. Wish you all the best. Love you all.